If you're a mom and you want to get your pre-childbirth body back, then you need to know about a tummy tuck. I'm Dr. Victoria Aimé, a plastic surgeon in Scottsdale, Arizona, and at my practice, one of my very favorite procedures is a tummy tuck. It is so incredibly gratifying for me to help mommies get their pre-childbirth body back, and I just absolutely love doing that procedure for them. A tummy tuck can help remove excess skin, tighten your abdomen, and remove stretch marks. So if this is you, you have to watch this video. I'm gonna walk you through the entire process. I know the initial consultation can be scary and stressful because this is an area of your body that you may not feel comfortable with and you may not feel comfortable showing people, but this is the time that we're really gonna talk about what to expect and whether you're a great candidate for it or if we should consider something else. We're gonna be talking about the surgery and what to expect from it, but really there's also an emotional component to it because this is probably something you haven't talked about with a lot of other people before. Even when my patients show up at their initial consultation, a lot of them will tell me, I don't like wearing these clothes. I wear baggier clothes to try to cover up this area. I can't wear a swimsuit. I don't want to be seen in that. And that's something that we want to change for you so that you feel comfortable not only in your own skin, but in the clothing that you wear. Some of the key factors that I'm going to discuss with you during the initial consultation are, number one, what's your goal of the procedure? Just making sure that we're picking the right procedure for you. Number two, are you planning to have any more children? Because if you are, we probably should wait to do this until after that time frame. Number three, do you have a big event coming up, a vacation, something like that? Because we want to leave enough time beforehand that you can be nice and healed for that. So those are the three main things that we're going to discuss. I would say the most frequently asked questions and concerns that I get from moms are, number one, is this going to take away my extra pooch? Is it going to be gone? That's probably number one. I would say the next question I often get is, how long should I expect for recovery? The third question is often, how painful is this going to be? Those are really the three main concerns, and that really has to do with how people plan their life. What can I expect? Who is going to need to help me? Do I need to buy a recliner or a walker or things like that? These are all questions we're going to talk about and try to demystify for you. One of the most common concerns with women that they tell me or that they don't, and I bring up with them, is that they feel like they're being selfish, especially when, there's a financial component to it. They need help and support, and they just feel like, I do all these things, and do I really deserve this for myself? And the answer is yes. Yes, you do. It's not selfish to want to have, your pre-childbirth body back. Not at all. The primary concern moms have is really how much downtime before they can get back to their normal life and their normal activities. Really, I would say within a week, you can get back to doing some of the things that you've been doing. Really within 2 weeks, you're doing a lot of things very independently, driving, showering, changing, clothing and dressings and things like that. Within those 2 weeks, you'll be back to your norm. On all of my patients, I'm going to ask them about their medical history, any medical conditions they have, any medications they take, any supplements, allergies, surgeries they've had before, implants, recent labs, things like that. Typically, I ask for a set of recent labs just to make sure everything is nice and normal. And if there are any medical conditions I worry about, then I typically converse with their primary care doctor or their specialist just to have clearance. But really, it's more than that. I want to make sure that you're optimized for this surgery so that we can be as safe as possible. Really, the only person that's not a great candidate for this is if you're someone that's planning to have more children. And in that case, I would always recommend deferring the surgery until after you're done having babies. I think that during our conversation, we're going to touch a lot on, what to expect in terms of results. I try very hard to give you a natural appearing result. I don't want to have a straight up and down flat abdomen. I think it looks operated on. My goal is always to give you a nice, subtle silhouette with nice subtle contours that are very common for a normal female body. How do moms prepare for surgery, and when does that really begin? That's a common question I get. So typically that's going to start at our consultation. That's really you acting on, wanting to do the surgery, wanting to learn more about it. That's our starting point. After then, once you decide that you've wanted to do this surgery, then we're going to start talking about making sure you're prepared in terms of nutrition, make sure your protein intake is up, make sure the timing is right for you. A lot of people will plan things around their children's school schedule or their work schedule, which is totally normal and perfect. I want this all planned out ahead of time so it's most convenient and works best for you, mostly so you have, a support system to help you get ready for this procedure. But we're really starting to plan for this right from the beginning, right when I meet you. When it comes to preparing for your surgery, I'm going to review your medical history, review your goals. I'm going to make sure that we have your compression garment ordered for after surgery, make sure you get pre-surgery drinks that you can have before, the night before and the morning of surgery, make sure that we have all the medications that you're going to need to feel most comfortable to decrease your nausea. We typically give people squeezers for their legs to decrease the risk of blood clots. There's a lot of things that we plan for in the weeks leading up to your surgery. And then even before you even get to the surgery center, I'm going to see you again in my clinic for a preoperative appointment. And that's really the time that we're going to go over consent forms, answer any questions you have, make sure everything is planned out and ready to go. On the day of your surgery, once you arrive at the surgery center, you're going to be greeted by our preoperative nursing staff. They're going to help take you back into that preoperative area. We'll put you in a gown. You're going to meet your surgical staff, which is a circulating nurse and a couple other people, as well as the anesthesiologist. Everyone's going to make sure that you are comfortable and ready and everything has been nice and teed up. You'll see me. We're going to put some marks on the areas we're going to be working on, and then we'll give you a couple of medications that basically just kind of help you go to sleep in a nice transition, and then we'll take you back to the operating room. On your day of surgery, it's not just you and me there. There's actually an entire team that's there dedicated just for you. So there's you. You'll be asleep having surgery. Me, the surgeon, the anesthesiologist helping ensure that you're safe and comfortable and asleep. Then there's a scrub tech that's going to help hand me instruments and help retract things for me so I can see better. And then there's actually also a circulating nurse in the room who's going to double and triple check everything, bring us supplies if we need it, anything like that. So there's really an entire team, and that's just the people that are in the operating room for you on your day of surgery. A lot of people ask me, what kind of anesthesia am I going to have for this procedure? And really the safest and most comfortable way for you to have a tummy tuck is to have full general anesthesia. We will have an anesthesiologist with you. They're monitoring everything, but this isn't a procedure we can really do well with you awake. Patients can feel more pain, they can be less comfortable. So really the best way to have this procedure done is to have you in a surgery center and put you to sleep. During the procedure, there are three main parts. So number one, excising that extra skin, all that loose skin, we want to take that out. Number two, taking out any fat cells that we can that are extra. And number three, tightening those muscles back up. So really we're going to dissect all the way underneath the skin flap, all the way up to your rib cage up here. And that helps us pull the skin flap down nice and taut and smooth. Then we're going to tighten up those muscles, kind of like a corset. And then any extra fat cells I see, I actually cut off with the scissors just to help kind of refine and contour that abdomen in preparation for us pulling that skin flap down and sewing it in place. And then the last step is just to bring your new belly button through. Common question I get is, how long does the surgery actually take? So the answer is it depends a little bit on how extensive of a tummy tuck we need, but generally for most people it's in the 3 to 5 hour range. Safety is our priority, so there's going to be things that we're all looking for, double, triple checking to make sure you are nice and safe during your procedure. That really starts from the time you come into pre-op all the way into the operating room, and that includes everybody on the team. So the anesthesiologist is making sure that your airway is nice and safe and protected. The breathing machine is working perfectly. That comes down to the circulating nurse making sure all of the bony prominences on your body, every part of your body is nice and padded so there's no sores at the end of the case. And then that also includes me and the scrub tech, making sure that we stay in the correct plane, making sure that we respect all the nerves and blood vessels as best we can, double and triple checking everything so that we can have the safest, best outcome. After my moms are completely recovered from their tummy tucks and their mummy makeovers, one of the things they tell me that they were most concerned about was what their recovery was actually going to be like. Immediately after your surgery, we're going to bring you to the post-anesthesia care unit called the PACU. We'll make sure that you wake up nice and gentle and that your pain is well controlled, your nausea is well controlled. Usually it takes about 45 minutes to an hour. And then we'll help bring you to your car with your ride and help you get on your way home so patients can recover at home. Some small set of patients do like to spend the night with us in the recovery center with one-on-one nursing care, but the vast majority of my patients go home. They really like to be in their own bed, in their own environment, and that's totally fine to do. In the first couple of days after surgery, there's a few things to expect. So number one, I see all my patients the morning after surgery and we do your first dressing change together. That helps kind of take the stress away, especially for the caretaker. We can do it together. There's nothing to be afraid of. And it helps me double check everything, make sure there's nothing that we're missing or making sure everything looks perfect. So that's the morning after your surgery. You'll come see me for that dressing change. Your pain will be pretty well controlled in those first few days. For the first few days, you'll be pretty numb. I inject a long-acting lidocaine medication into the muscle and into the incisions, and that really helps take the edge off of the pain. So typically for the first couple of days, people are sleepy from the anesthesia. They might be sore. They're having a little bit of difficulty getting around just because their tummy's a little tighter than they're used to. But they generally tell me that, really wasn't as bad as I thought it was going to be. You're going to turn a corner around 2 weeks, but for those first 2 weeks, you're going to be pretty tired, maybe limited to just walking around, which I want you to do. I want you to be active, but I don't want you to overdo it. So really for the first couple of weeks, it's mostly just walking around. From 2 to 4 weeks, you can do a little bit more aggressive things like walking around the neighborhood if you feel up to it. And then by about 4 to 6 weeks, you're gonna start to feel like yourself again. You can get back into doing light to moderate exercise and work your way back up to where you were before. Or if you wanna start a new exercise regimen, that's the time frame that we're looking at. During your consultation appointment, we're gonna take some measurements of you and some photographs, but what those measurements help us do is pick the right size compression garment for you to wear after surgery. So initially, you're gonna come out with an abdominal binder on, and that helps decrease the swelling, keep everything nice and in place, basically in terms of dressings. After 2 weeks, we're gonna transition you into a compression garment, and that's really kind of like a onesie or a romper, if you will, and it clasps up the front, and that helps to keep that compression down, but it doesn't have the risk of creasing that the abdominal binder does. So really, I put people in about a month of compression. That's a lot of times for your comfort to decrease that swelling and make sure that you feel better. Most of the swelling has gone down by about 6 weeks. By 12 weeks, it's pretty close to gone, and by 6 months, it's almost nearly gone. But you're gonna see your results right away, day one. I would say that the majority of the recovery is completed by about the 4 to 6 week mark. After surgery, that's really not the end of it. So you're gonna see us a bunch more times. Number one, you're gonna see us the day after surgery. We'll do that first dressing change together. I see you at 1 week, make sure everything's still looking okay. I see you at 2 weeks. We'll clip any little suture knots you have at that time. I see you at a month, at 3 months, at 6 months, and at a year. And that's really to monitor that you are healing the way that we want you to heal, making sure everything is perfect as best as it can be, that we're not missing any complications, infections, anything like that. We're really just reevaluating all the time that you are healing just exactly the way that we want you to. We still want you to live a nice, healthy lifestyle. So the sooner we can get you back to your norm, the better. That's why I encourage my patients to resume their exercise regimen within that 4 to 6 week window, get you back to feeling like yourself again. Outside of that, in terms of maintaining your results, it's pretty long lasting. Unless patients get pregnant again, most of the time their result is what they see for a long time. These results will last you through time. Your body will continue to age, but you really shouldn't develop that kind of saggy skin, those stretch marks, things like that again, really unless you gain a lot of weight or you get pregnant again. Otherwise, it's gonna age very gracefully with you. If you're a mom and this sounds like you, and this is a position you're in, and you're interested in maybe doing something about it, I really hope this helps shed some light on the process for you. The next step would be to schedule a one-on-one consultation with me. You can schedule a consultation with me online at your convenience or over the phone, whatever works best for you. My website is metropolitanplasticsurgery.com, or you can call or text me directly at 480-550-9493.